Thank you very much. Thank you for having me. I remain my humble self, Pharmacist Eze Ambrose Igwekama, the National Chairman of our Social Committee Pharmacy of Nigeria. Here with me is the National Secretary, Pharmacist Omoke for actually, National Executive Committee that are here present once again. Ladies and gentlemen, gentlemen of the press, good afternoon once again. I feel that it is very important for today. The world is marking drug abuse and illicit drug days. Today being 26th June 2025, the global community comes together once again to observe International Day Against Drug Abuse and Illicit Trafficking. A day is set aside by the United Nations to raise awareness of the devastating consequences of drug abuse and illicit trafficking on individuals, families, communities, and the nation. As the national chairman of the Social Committee Pharmacy of Nigeria, we are very, very close to the community. We join millions around the world to reaffirm our commitment to the fight against drug abuse and to call for urgent, coordinated, and sustained action to combat this public menace in our dear country. The theme of this year is very clear. The evidence is clear. Invest in prevention. Resonate deeply with the vision of ACPN. It reminds us that we must shift our focus from reaction to prevention. As a community pharmacist, trusted and accessible healthcare provider in the front line, we witness firsthand the silent crisis of substance abuse in our community, especially among youth. And that is why ACPN for more than a decade has demonstrated a concern on massive awareness campaign through our national anti-drug abuse competition among students in secondary school nationwide. And the essence of this annual competition is for prevention and also to disabuse the minds of the younger generation against the consequences of drug abuse, which align with the same with the UNODC strategic plan for substance abuse. If you agree with me today that the reports from the UNODC in Nigeria, 2 among 20 people are currently engaged in drug abuse, and the most common drug Nigerians abuse is commonly known as tetrahydrocannabinol. In a layman's name, you can call it cannabis. Cannabis is what they normally know. And last year, in our competition among the students, we compel the student to write a letter to the president of the nation, Ahmed Tinubu, on the prevalence and the manners of drug abuse and profile a solution to that. And I believe that that letter will be shared today because we know the consequences, the sequelae of drug abuse among the youths. Every tablet without prescription, every codeine cough diverted, every hard drug traded irregularly is not just a crime, it is a threat to our collective future. Drug abuse fuels mental health. There's a lot of mental disorder, mental cases here and there. Crime, school dropout, family breakdown, premature deaths, a crippled dreams, and sabotage national development. ACPN therefore call on all stakeholders, government, civil society, security agencies, religious and traditional leaders, parents and educators to intensify their role in prevention, education, and early intervention and rehabilitation. That's why ACPN, we are supporting a bill being sponsored by Honorable Senator Ned Nwoko to establish the National Institute on Drug Awareness and Rehabilitation. We find out that most of the rehabilitation centers within the nations are not something to write home about. And we need that kind of bill if it can be build among 6 political zones, geopolitical zones, so we'll be able to help those that are already living in drug abuse, substances, and consequences that are aligned to that. We further also highlight the following action points on contribution to drug-free Nigeria. Strengthen the regulatory environment. The ACPN urged relevant agencies to enforce strict control on distribution and sales of controlled substances We must close the ring ponds that allow prescription drugs to enter into illicit market. So I wonder what the security agencies, what they do is alarming and is unacceptable that most of those drugs enter through our porous borders, and people that have commonly find it within the market where they don't supposed to find it. Also, to also empower community pharmacies, because we are the front point of call in communities. As far as we are concerned, community pharmacies must give community pharmacies a central role